and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today you wanted to talk about some advanced sciatic treatments that someone could try. I guess these are just basic exercises you could do to see if you can decrease your sciatic pain.
Right. If you've got pain, let's talk about sciatic pain to begin with. What does sciatica mean? I think some people kind of get that confused about what it really is. And it's pain that radiates into the buttock, down the leg, all the way to the foot or even the toes. And that, by definition, is sciatic pain.
It could go a little bit less. I mean, it could go like to the mid-calf.
Sure.
For the reason it doesn't go all the way to the foot doesn't mean it's not sciatica.
Yeah, I may have misspoke there.
Yeah.
But yeah, it goes down one of the legs typically.
Right. And with this, it's really very important that you know what's causing it. Right, Brad?
Exactly. And that's part of it. With sciatica, from the definition that I found, it's from the low back. Although it could be from a structure lower, like in the buttock, the piriformis muscle,
yeah,
or something else irritating that sciatic nerve.
Right.
But we're going to just assume, because I think a lot of times, probably I could be safe to say the majority of the time it's from the back. I don't know if that's...
So generally from a herniated disc, basically.
Right.
So that's what how we're approaching it today, is that your sciatica is from a herniated disc.
Exactly.
So, and by the way, Brad, we have a lot of people that are watching us for the first time. Please take a second just to hit that subscribe button.
Right there.
We provide a lot of videos on how to stay healthy and fit, wide range.
Right.
And we upload every day.
You bet.
So,
okay, so we're looking at the low back, because that's where a majority of low back herniated discs are, vast majority. And
L4, L5, L5,
yep,
S1.
Right, so here's the pelvis and your belt line. If you're not familiar with the anatomy of this model, the belt line would go right across here. So this is here. Here's the sacrum, L5, L4. This red disc right here, if you can see it this far away, you don't have a red disc in your back, but that's just there so it brings attention to the involved disc for this model. And if you look right here, I'll get up closer so you don't have to zoom up. If you look right here, this red bump right here is a representation or a model of a herniated disc, which is pushing into this nerve. As you can see, this is a nerve that actually runs down into the sciatic nerve and down into your leg. And that's why a herniated disc, the symptoms and pain, numbness, and tingling are felt down in the leg. But we're going to talk about some exercises that help reduce or get that bulge smaller. But not only that, we're going to show the first exercise that we have a number of videos on that is kind of the go-to exercise to do this, but it doesn't always work and it gets more difficult. And then we're going to talk later in the video on how to get those difficult
You want to show
bulges.
this now or later?
Yeah, let's show it now, because we just showed a model here, but now we're going to show...
It's really important to understand this, so we'll take a second.
This is a model of, this is actually a coffee cup. It's a vertebra coffee cup. We should actually mark these L4 and L5. This is going to be L5, and then this is going to represent the disc. And a disc has fluid inside, or a jelly substance, and then it has an annulus to the outside of it that holds everything in place. It's real tough and it is flexible. And so here we go, we got the disc on top. So when you walk or you jump, there's a little shock absorbing going on, and it allows, when you bend forward, each vertebra has to flex a little bit. The bone doesn't flex, so the disc has to flex.
Right, that's where you get your motion and a little bit of height, and then, like you said, the shock absorption.
Right, allows a little bit of rotation, not much. Okay, now let's talk about a herniated disc.
On a healthy disc, you can bend forward like this and nothing happens.
Exactly.
Right.
If you've got a herniated disc,
or a disc that's weakened over time because you do a lot of bending forward or sitting, this is what could happen.
Right.
Right.
Can you zoom in on that, Lonnie? Okay,
It
you got
shows?
okay, good. So right there, that's a herniated disc. Now this model, it's hard for me to position this where I want to.
Yeah, because generally it goes more off to the side.
Right, just like on the model I showed you earlier.
And that's where the nerves are coming out, and it can actually hit the spinal nerves.
Right. Now you could get the bulge, see if I can get this to come out, not off to there, but even more laterally or to the side like that. Okay, or there's actually a possibility of an anterior or the bulge comes out. I don't know if I can make it. There we go, to
A
the
lot less
front.
likely though, because there's a big wide ligament there that,
Right.
that helps hold it in place. So,
But there is, a slight possibility. So we want to show you some exercises. If you do some exercises, should we go right
Yeah.
into that? The typical herniated disc,
you want to throw me a pillow, Brad?
sure.
Because sometimes people can't even get into this position, Brad. Sometimes they have to start with a pillow here.
Exactly.
They start like this, and then eventually they move to the point where they can move the pillow out, and they can just even get into a static position like this onto their elbows.
Right. Let's even back up one step forward.
Sure.
If you have a herniated disc, there's a good possibility your posture is going to be flexed forward, and it's very uncomfortable to go up and very unlikely to go backwards in the standing position. And it's because of the mechanics of that disc is forcing you this way.
At the very least, you're going to have trouble bending back.
Right.
You know what I mean?
Yep.
I mean, you may not have trouble straightening up, but you're going to have trouble bending back.
Exactly.
So,
The idea is that when you can allow the range of motion of backward bending, then the disc is back in place when it's pain-free.
so again, we
Go ahead, Bob.
generally start pillow, and you might even lay here for 5 minutes or so. And then if that feels fine, you're not getting pain going down your leg, tell them what we're looking for, Brad. We're always looking for the symptoms to do what?
We want them to centralize. So if you've got the symptoms starting here and they're going down the leg, they might go to the knee, sometimes to the ankle or even into the foot, and you lay like this, and why don't you lay flat, Bob? If you lay like this and after a couple minutes, let's say you got numbness into your foot, the foot starts to feel normal again. That's a real good sign you're on the right track for exercises here, or even just this position. And as you lay there more, if it feels like it's feeling more normal here and more normal here, and it's working up this way, you're doing great. Then as a therapist, I'm going to say, Bob, why don't you try a press up?
Or maybe even just get up on your elbows.
There you
for a
go.
little bit.
Yep.
And then a press up where I put my hands below my shoulders like this. I'm going to press up to the point where, again, I don't want to increase the pain. And if it starts going down my leg, I don't want to go all the way up then either. I'll just maybe work into small range right here.
And the whole thing that's going to guide how far you go up or how far you work it is if the pain, the numbness, all the symptoms that you may have in your leg, they're disappearing down here and they're going more central. Central being this. This would be the center. So if you do on your stomach, you take the pillow out and you end up doing 5 or 10 press-ups, and all of a sudden the symptoms are gone in the leg, boy, you've got a really good chance of
But let's talk about, Brad, what normally happens. A lot of times I'll get someone in this position to start doing it. It's like, it's really not helping. Or
Sure.
So then the first thing I try, Brad, is if you want to throw me that towel.
Yep.
I don't know if you've done this one lately, but I'll just put a towel right underneath here.
Oh, yeah, actually, I don't use that one, but
Yeah.
I probably should try that.
I put a towel right under the pelvis here, and now I do it. The same thing. I put it on the side that the pain is at.
Yep.
So my pain is at this side.
Okay.
I put it on that side, and then I have them try it.
Okay.
And they go, oh yeah, that feels a little bit better. Now I don't get as much pain going down the leg,
Sure.
or it's coming up a little bit. So that's one little variation you can
Okay.
do. Again, kind of an advanced move.
Well, I want to show you another trick that I've learned if the press-ups aren't working very well.
Do you want to do overpressures at all?
Nope.
Okay.
I want to show.
Do you want me to do it?
No. Well, you can do it. Yeah,
Yeah.
let's do it. This is a kind of a weird name, but we call it in the therapy world roadkill. But go ahead, get in the position once, Bob. If the pain and the numbness or symptoms are in the right leg, you're going to bring your right leg up in that position.
Oh, which one are you talking about, Brad?
Roadkill.
I'm not sure which one that is. I always talk about the banana first.
Oh, we have here.
Oh, you're in this one?
Therapists have their own
Yeah.
tricks after a while. You know this one.
I know, but roadkill, that, okay.
So I'll have someone go in this position, and if sometimes just doing this, I'll say, oh, my leg's starting to feel better now. Then I know we're on the right track.
Sure.
And then I may add the press-ups as long as the symptoms and the pain are going out of the leg.
I had forgotten that one, Brad, to be honest with you.
Yeah, that's the one I use. I don't use this towel one, so you're getting a lot of good information.
So a lot of times and often we'll take a towel or a sheet. Let's say you start getting some improvement now with what that, and this would be an advanced one too, is you take a belt or a sheet,
Yep.
and you're going to go ahead and put it around you here. And this is to try to advance it. So again, you're going to lay down, and now you're going to put your hands on the sheet like this.
This would be if a regular press up is doing well.
Yeah, exactly.
Then this would be the next step.
Right, now you're going to put some overpressure on the back and you're going to get a little more bend. And this is to advance it along and yeah, to try to get that pain up even. This is where you maybe got it up to the buttock and now you want to get it up even further.
Yeah. This one is oftentimes you need help because the sheet wants to slide too far up.
Right.
You might need someone to help pull it down by your belt line.
We've had some people even just do it this way, right, Brad?
Yep, in the standing position.
Yep.
As long as the pain in the leg goes away when you're doing it, you're on the right track.
Right. So, what's the other one you want to do, Brad?
Well, this is the other one I'll go to if I'm having problems. I just call hook line rotation because it's easy for me to document and to write down. If it's on the left side, down the left leg, and I've tried my other techniques and they're not working, I'll go to this one. And this one, I would have to say, needs to be done by a therapist. I can do it to myself and I can teach my patients, but over YouTube, it's going to be hard for me because you have to shift your hips like this. You're going to bring your knees up and slowly go over this way. And you're only going to continue this if it feels good, and it will feel good right away. If your leg starts feeling better right away, then you're going to continue with it. If it just hurts and the leg starts to hurt worse, you stop immediately. But again, that's a little bit more advanced.
Mulligan actually does one like that too. It's almost exactly what you
Sure.
said.
Yep. All these great therapists that we really like, they think alike.
Right. Exactly.
That's why they're successful.
All right, if you get stuck, you're going to want to try to find a therapist trained in the McKenzie method, so we'll go ahead and link that up to that video that you can watch.
Right.
And remember, we can fix just about anything.
Yeah, except for that broken heart, Bob.
Well, we're trying.
Yeah, when we get that baby figured out,
We're going to be in good shape.